primarily have an outpatient background, but we were super busy. Some days we would see over 150 patients a day. We had a team of a few registrars, but I would say personally, when doing registration, I've done 50 to 75, even to 100 by myself, just, depending on what our clinic schedule is like for that day. Definitely teamwork goes a long way, but definitely used to high volume, and I find that I thrive in that kind of environment just because it's busy and keeps things going. Yeah.
Perfect. Thank you.
Yeah.
And then tell me about your experience with insurance verification and speaking with patients regarding benefits and copays and any financial responsibility.
Absolutely. So before I came to my previous organization at Children's, I worked in private practice and we did all of our own insurance verification. I know a lot of the times with Epic, it's built into E-Verify, but we called the insurance companies manually because it was private practice. We were made to know exactly how the visit was going to be covered, what the patient responsibility was, and we had to collect that up front. So I've had a lot of difficult conversations with people, especially people coming in and needing a neurologist, because that was a neurology office as well. There were several times where I had to, tell these families, your coverage isn't great. Your child's probably going to need an MRI and an EEG. So that type of news is not fun. But going into those situations, for me, I have found what helps is having a list of options or recovery behaviors that I can use. So if they're going to face financial hardships, I have the information ready for patient financial services or financial counseling or charity care, or, just knowing what's available so that I have options to offer the patient is really important, especially if you want to make sure that they're having a good experience. So it's not easy to give that kind of news, but I have a lot of experience delivering not great news. Yeah. And I'm happy to give specific example if you would like one.
No, excuse me. I think that's perfect.
Okay.
And I appreciate you sharing that. And I know that you mentioned yesterday when we spoke that you're an Epic super user.
Yes. Yeah. Yeah. So I was an Epic super user for several years. They did something at my org, like a contest where
There you are.
Hi.
So you guys did a contest at CHOA.
Yeah, we did Super User of the Year. So I was recognized twice by my manager, and then they voted to elect me as Super User of the Year. And then when I moved into a supervisory role, I wasn't allowed to be, just like a patient access super user anymore. So I moved into the system access leader side, but still super involved in user acceptance training when we would have Epic upgrades, like all of the fun super user stuff. So yeah, I enjoy that kind of thing. Yeah.
Nice. I love it. All right. So tell me about a time you had to deal with an upset patient. What was the situation? How'd you handle it? And what was the result?
So, we had definite protocols in place for service recovery. So we had our service behaviors, smiling, greeting the patient, owning the problem, thanking them for the opportunity to fix it. So a specific example of that, we had with our high volume, we still could not meet the demand. And this is when I was with neurology at Children's, we couldn't meet the demand. So we were getting way more referrals a month than we could ever possibly see with the amount of new patient slots we had available with our docs. So a lot of the difficult conversations I was having with patients was, sorry, you were 2 minutes past the grace period, but the provider is refusing to see you, and it could be a patient that was waiting months and months to be seen. So we had a family who had driven all the way up from Florida, like somewhere on the southern sort of side of Florida. So they had been on the road like all day, and they specifically picked an appointment towards the end of the day so they could give themselves time to get there, Atlanta traffic, and we try to warn them about that as well. But they got caught in an accident. It was like the perfect storm of problems. So the patient had a seizure in the car on the way there. They got stuck in an accident coming up 85, and it was horrible. So in this particular instance, you get the parent in and you can tell they're flustered. So you give them a second to sort of collect themselves, reassure them. You hit sign in as soon as they get there, so that time is recorded, but you can give them a second to catch their breath, explain the situation, make sure that I have a really good understanding of the situation, right? And in this particular situation, I knew this provider had already told me, if this patient shows up, I'm leaving. Like, I have something to do after work today. I can't see them. So when they came in a little bit past the grace period, I had a feeling this provider had already left for the day. And when I went back to find her to ask her still if she would see them, she was gone for the day. So I had to put on my thinking cap. There was another doctor working in clinic that day, and I had just helped him with another major issue. So leveraging that partnership, I was able to, explain the situation to the provider and get them to stay late to see the patient. So it's those rapports that you build with your team that really help get you through those types of situations. So because I already kind of had an idea of what to expect, I knew what to offer. I knew, how to make sure that they were still seen. And that was the case a lot of the time, just with such a need. But
yeah. Well, it sounds like you saved the day, because that
yeah,
sounds so stressful for the family. I can only imagine. So
try
nice job
to.
with that.
Absolutely. Some of them were waiting, upwards of 6 months to be seen. So
Yeah, that's
gotta
so
do it.
hard.
Yes.
Yeah. What does customer service mean to you?
So for me, good customer service, I will say Children's did a really good job of, making sure that we focused on the patient experience. So there were always metrics to meet for that. But I would say prompt responses. So getting to something in a timely manner. I never want to have a patient or a family say that I didn't follow through with them. So you have to close the loop every single time. You want to make sure they got exactly what they needed and that they're satisfied. It may not be exactly what they came for, and they may have had to wait a little bit, but all along the way, you're giving them updates, you're showing them empathy, and you're following through, because that's the biggest thing. Like, they may come in on the wrong foot, or we may make a misstep as an organization, but as long as you can tie a neat little bow on it, close the loop, make sure that by the time they leave that you've turned the experience around. It's super important, especially just maintaining faith with a company or an organization. Those families are going to want consistency and empathy and follow through. So I would say that's kind of what customer service means to me, that empathy and putting yourself in their situation, but also working hard to find an appropriate solution and following through so that they feel like they've been taken care of. Yeah.
That is really important, because you're in your position, you could make or break their experience and what they tell the next person about the organization and stuff. So
absolutely.
it
And
trickles down.
absolutely, we would get our patient experience department would say, we have an escalated parent and they haven't had a great situation, we really got to turn this around. And patient access, we really do that. If they come in and they're mad, they usually yell at us. They don't yell at the nice doctor who's seeing them. They're excited to see the doctor, but if they're frustrated, sometimes they can take it out on us. And I would say I have a lot of experience being the brunt of that, but at the same time, it has made me really understand the struggles that some people go through with their health and how scary it can be. And sometimes all you need is a nice person to really take the time and to look you in the eye and feel that they actually care about you or your child. And I think that's really important to me. Just when they check in, they check out, they have a friendly face, they have someone that they feel cares about them and their outcome. So
yes,
super
I couldn't
important.
agree more. You've kind of covered this a little bit, but is there anything else you would want to say about how to improve dissatisfied customers' experience?
So I would say for me, I was really big, especially when I moved into a leadership role, I was really big about process improvement, right? So especially during COVID, limited resources, you have to get creative with staff, even keeping staff engaged, So I would say just prioritizing, looking at trends. So yes, fixing a situation in the moment is great, but if there's something bigger that's causing the same person to run in, or causing different people to run into the same issue, then we need to look at it. And in healthcare, it's really easy to just come in and do your work for the day and go, oh man, I didn't get to that, but I'll do it the next day. So I'm kind of the person that enjoys getting into the nitty-gritty and I try to be efficient so that I have time to get into the nitty-gritty, because a lot of people just don't have the time. So if we
Yeah.
can fix the issue that's causing the concerns from the families in the first place, I would say that's another way that I really enjoy improving the experience, because if we're doing some crazy workaround and it could be streamlined and better for us and the family, like I'm definitely not afraid to like suggest something to my, supervisor. But yeah, I would say just having that empathy and follow through and treating them like a human being, because nowadays it's just easy to feel like you're another number.
Yeah.
Yeah.
I totally agree.
Yes.
What would you do if you didn't know how to help a patient or a customer?
Ask someone. Especially being new, I anticipate there being things about the organization specifically that I will not know. I'm not the kind of person that's afraid to ask for help, but I am the kind of person who doesn't like to ask the same question over and over again. So
Yeah.
I take notes, I make cheat sheets for myself until it's deeply ingrained in my brain. But I'm definitely not afraid to ask for clarification if I'm not sure, just because I want to make sure that I'm doing the right thing. And I don't want to just do something and hope, "Ooh,
Yeah.
I hope this is okay." I'd rather ask and be sure.
Yeah.
But I know it's annoying to get asked the same question. So
Well,
I
that's good. And
learn.
I think that's the habit, because you might have the question again, but
Yeah,
taking
yeah,
notes and, just making sure that you're not
happens.
relying on somebody every single time, especially if
Yeah,
you've already asked. I think that's good.
absolutely. Yeah.
What skills should a great customer service representative have? You've answered that throughout your questions, but
Yes.
in summary,
I would say kindness. Kindness and an ability to have empathy and really put yourself in someone else's shoes. I think it's easy to take our good health for granted. Working in healthcare has really grounded me and made me realize just how lucky I am. So I think reminding ourselves that the work we're doing is super important and that these patients are relying on us to be empathetic and to care about them and their children like they care about themselves and their children. So empathy, I would say, is the one thing I've seen in my career that has made or break people. um, because you can't fake it. People can
yeah,
tell if you care about them or not. So just empathy, I would say. Empathy and consistency are
yeah,
really big. Yeah.
I like that.
Mhm.
And then the age-old question, strengths and weaknesses.
For me, I'll start with my weaknesses because those are the ones that I hate talking about the most.
Yeah.
It's hard for me to say no sometimes. Like even when you were asking me about times to schedule this, like
Yeah.
we were gonna try and do it yesterday, and I was like, I could move some stuff around. So I would say that's something that I struggle with, just because I am eager to do the best job I possibly can. So
Mhm.
sometimes I can be my own worst critic, and I definitely have grown a lot in that regard, but I would say that is one thing that I continue to work on about myself. Now, as far as my strengths, I'm an excellent multitasker. Um I love a challenge. I'm not scared of numbers or metrics. I think part of the reason I was able to be so successful at Children's is because I was not the type of person to say, that's not my job, right? If my boss was struggling with something, she knew that she could come to me and brainstorm ideas with me, and that I would make